Instead, we have the opportunity to make a habit of empathy, to recognize ourselves in each other.
How to bring empathy to healthcare. Propose including patients or committees to make healthcare decisions, non-insurance or medical people. Excellent idea. Next one, create neighborhood funds or caretaking for neighbors, children, child care, transportation, meals. Excellent. Youth community service, volunteering to help elderly or sick in exchange for college scholarships. Wow. Like that.
That happens here.
Public assistance recipients provide services. Want to elaborate on that?
I thought that by giving them the opportunity to provide services would be a way for them to build, they said, self-esteem for themselves. Also to make it them to be more, marketable, so they can learn skills, different skills. This is one way that they can feel like they're contributing.
Excellent.
But like there was an AIDS quilt for all the people who died of AIDS. You could have something like that of all the people who've suffered or died because they were denied care because they couldn't afford.
Could you imagine that?
Like a square for a square for each story, and it would be gigantic.
Yeah, really. It's a good idea.
Yeah, that's pretty heavy. Yeah.
In the same way that the AIDS quilt did.
Visual.
Yeah, like a concrete,
Right.
visual, symbolic
art.
representation.
An art piece.
Empathize with doctors or other medical professionals when you encounter them, because they need empathy as much as the patients do.
Very good. Very good.
Petitioning MoveOn to create an ad that has empathy as a core value in relation to healthcare.
An advertisement. Excellent.
I was thinking of setting a goal of having a certain number of conversations with people in my own personal circle, specifically around empathy, and then connecting that to healthcare.
Very good. That's the best.
Letting people know that they're great, and that they're helpful, and that and either be able to wear it on their uniforms or their stars and their awards,
It's like a hand up.
or I just was saying, I just didn't understand the visceral response I would get from somebody in the movement who always ends every one of his emails with, "You're great," And the first time I heard it, I was sort of like going, I didn't really do very much,
It's like Edwin.
but there, you
Edwin,
must
he said
have something
best.
there that I did that I don't remember. But then, and I realized later that he's put it on the bottom of every one, but still, it felt great.
And so we could go around sticking these
Yeah.
empathy stars on people.
And it entertains the other people, makes it brightens up their day because wow.
Wanting full choices in healthcare, including alternative modalities and holistic approach to healthcare. And that includes healthy habits, organic and raw food being available, exercise, and Dawn was saying also having independent research and education around taking responsibility for your own health care, and that could include acupuncture, osteopathy, homeopathy, energy medicine, and that it all involves care and consideration. And
So basing it empathy and connecting it with wellness.
When I think of Obama talking about an empathy deficit, I read that as something very pervasive in our culture. Healthcare is one example, but and particularly what I said earlier was that I find I've been involved in various activist projects in my life, and I have found within activism itself a lot of empathy deficit. People trying to do good in the world, and maybe it works for a while, and then people get at each other's throats within an activist group. So my focus is, in the long term, thinking of this whole century, I want to make a contribution to a culture of empathy. We we've heard a lot about a culture of violence. So a culture of empathy is like saying, my timeline is way beyond my lifetime. So how do I make a contribution to that? Working in a small group that might do something in the world, but also walk its talk within the group itself. And that would be my contribution to a culture of empathy, if I can do it.
I'd like to.
Oh, right, yeah, Obama said it won't be easy. I think he's point.
Often when we go to the doctor, particularly if we have a serious or complicated situation, that we could really use support. And so being willing ourselves to accompany our friends when they're in that kind of situation, or myself, I'm a single person, I live alone, and they're going to tell me I need a colonoscopy, and who's going to drag me home from all of that?